What would you do if you were faced with a patient showing signs of a heart attack? Let's delve into a case study that will enlighten us on how to handle such a scenario. Imagine a 60-year-old woman who walks into the emergency department, clutching her chest in pain, her breath coming in short gasps, and a wave of nausea washing over her. Her medical history unveils an alarming tale of diabetes and a long-standing relationship with smoking. On examination, the woman seems anxious, her skin covered in a sheen of perspiration. Her blood pressure is sky high, her heart racing against time. An EKG paints a worrying picture with ST segment elevation. Blood tests add the final piece of the puzzle, revealing elevated cardiac enzymes. The diagnosis lands like a gavel: myocardial infarction. Immediately she is swarmed with a flurry of life-saving measures. Oxygen mask on, aspirin and nitroglycerin administered, and morphine for her pain. Intravenous beta blockers are given to rein in her galloping blood pressure. Next, she's whisked away for a cardiac catheterization, which reveals a terrifying 90% blockage in one of her coronary arteries. Emergency angioplasty and stent placement swiftly follow, prying open the stubbornly blocked artery. She's then moved to the cardiac intensive care unit for vigilant monitoring and further treatment. In this whirlwind of action, the role of the nurse is paramount. From the moment the patient stumbles in, the nurse is at the forefront, assessing and identifying the signs of myocardial infarction. The nurse is the watchdog, administering medications, keeping a close eye on vital signs, and providing the much-needed emotional support to the terrified patient. During the catheterization and angioplasty, the nurse is the cardiologist's right hand, monitoring the patient's condition and assisting in the procedure. Post-procedure, the nurse is the patient's guide, educating her on care and lifestyle changes to prevent a recurrence. But the patient's journey doesn't end here. She is enrolled in a cardiac rehabilitation program. Here too, the nurse is instrumental, emphasizing the importance of the program and encouraging the patient to quit smoking, eat healthy, and exercise regularly. Thanks to the swift response and comprehensive care of the healthcare team, our patient makes a successful recovery and resumes her normal life. This case study underscores the importance of early recognition, prompt treatment, and comprehensive care in improving outcomes for patients who suffer from a heart attack. So, remember, when faced with a potential myocardial infarction patient, time is of the essence, and your role as a healthcare provider can make a world of difference.